Hi guys, this is Dr. Jasmine. I'm coming at you with another video. I'm going to try to do these videos once a week, and my intent is just to bring some interesting studies. Maybe it's COVID related, or maybe it's just medicine in general to all of you, and hopefully we can have a good discussion. So if you like this video, definitely click on the like button, subscribe, and leave a comment in the comment box. So today I'm going to talk to you about this really interesting study that was published in JAMA, and it's called Characteristics and Outcomes of Hospitalized Patients in South Africa During the COVID-19 Omicron Wave Compared with the Previous Waves. So they looked at hospitalized patients with COVID-19 in what's called the Netcare system in South Africa, and it's basically a system of hospitals, actually more than 10,000 hospitals. And they gathered certain data, certain information, and they compared that to the same information gathered during previous waves. So just kind of to give you some background, South Africa has had 3 prior waves, one with the original strain, second one was with Beta, third one was with Delta, and then November 15th, we started to see cases go up, and of course that was later identified as this new variant, Omicron. So what they did is when the positivity rate reached 26% with Omicron, they went into the electronic database, they gathered certain data points, and then looked at those same data points with the prior waves when the positivity rate was 26%. Netcare's policy is to test all admitted patients for COVID-19, so everyone gets a PCR test or an antigen test. And they basically looked at patient characteristics, the need for oxygen and mechanical ventilation, admission to ICU, length of stay, and mortality rate. And about 70% of patients with a positive COVID-19 result during the prior 3 waves were admitted to the hospital, compared with only 41.3% in the fourth wave. So basically around 70% with each previous wave were admitted into the hospital. Patients hospitalized with COVID-19 were older in the Delta wave, but tended to be younger in the Omicron wave. And it's probably because with the Delta wave, you had predominantly, again, older patients being hospitalized. So they likely had some T-cell response to Omicron, which would explain why mainly younger people with this most current wave were hospitalized. Patients with COVID-19 who were hospitalized, interestingly, had fewer comorbidities like diabetes, hypertension, chronic kidney disease. They were predominantly unvaccinated, but 24.2% were vaccinated. And they were more likely to be admitted for something other than COVID-19 and then found to be positive, so less likely to come in with respiratory failure. So they also found that patients were less likely to require oxygen, mechanical ventilation, length of stay was shorter, and admission to ICU was also less compared to the Delta wave. For example, admission to ICU was 18.5% in wave 4 versus 29.9% in wave 3, and the death rate was also lower, so 2.7% in wave 4. I thought this was a really good graph to share. I got this from the Financial Times, and they actually compare cases, admissions, and deaths between Omicron and Delta. So here you can see Delta, and you can see that the hospital admissions seem proportional to the cases. But coming over here to Omicron, you can see this rise in cases, but you don't see the same rise in admissions and deaths, which is wonderful news. Possible explanations, I think it's still evolving, but we do have several studies that have demonstrated that Omicron replicates less in the lungs than in the upper airways. So the theory is that, of course, we know it's more contagious than Delta, than other variants, but it's less likely to cause infection in the lungs. In terms of some unanswered questions, we need more information to determine what role does vaccination and or prior immunity play in what we're seeing with Omicron in terms of less hospitalizations, less deaths. What we do know is another very interesting study out of South Africa showed that you get a robust T-cell response against Omicron despite all of its mutations in patients who have had natural immunity or have been vaccinated. Of course, this is all data pertinent to South Africa, and we need more data in other parts of the world. In Japan, we're starting to see Omicron cases go up. In the US, cases have been increasing very dramatically and has yet to peak. And outcomes in the US remain to be seen. Of course, as cases go up, your hospitalizations are going to go up. So, hopefully this data that we're seeing out of South Africa is also what we see in the United States, meaning less hospitalizations and less deaths with this most current wave. Well, thanks for tuning in. Like I said, if you liked the video, just hit the like button. Otherwise, I'll see you again next week.